One day that was just observing one surgery, and it happened to be at that time a craniotomy, and then I had to see the actual live brain tissue for the first time. Right on that moment, I decided I really fell in love for neurosurgery. We can call it a love at first sight. I am a neurosurgeon. I was trained in residency in neurosurgery, of course. After my training, I added extra layers of training with focusing on spine surgery. Most patients that seek spine care in a spine clinic, they have a combination of symptoms that goes from what we call axial pain, which is pain starting in the neck, the mid-back, or the lower back. And sometimes the pain can radiate down the shoulder and the arm towards the hand. The patient can present with back pain, could be acute and chronic, and normally if it radiates down following, we call it a sciatica trajectory affecting the left side of the hips and legs, going sometimes all the way to their feet. And with that, some patients complain of numbness and tingling. Normally has an open conversation about how those symptoms are affecting their patient's life. Right after that, I always have an open screen with the imaging pertaining to that patient. Always will start with conservative care. We go through the pros and cons of different aspects of rehabilitation and physical therapy. Then we talk about options in terms of pain management, such as injections. Finally, we start working on the possible surgical option for that patient. We always tend to start offering the least invasive option as a first step, such as a minimally invasive decompression. If the case need be, an open exposure with a spinal reconstruction for more severe cases such as deformity cases. My role here is to try to guide those patients through that process, and of course try to use my knowledge and my expertise to improve their symptoms, but most importantly improving their quality of life. My first language is actually Portuguese. You can call it Brazilian Portuguese. And then of course English is I can call it my second language. After that, that's the language that I most often use. I'm also fluent in Spanish, so I'm definitely able to help population for the Latino population and Hispanics in general. When I'm not seeing patients, what I like doing the most is to stay with my family. I really like staying home. We like cooking and playing games and watching movies together.